I'm Peter Block in New Orleans at ACC 2019, and this is the wrap-up for day 2. We've had a lot of really good trials at the ACC meeting this year, so we're going to wrap up with what we think are the most important of the day. We've got partner and Evolute, and I'm going to start with that. Deepak, your thoughts about that? I should introduce everybody. Deepak Bhatt on the left, Kim Eagle in the middle, and I'm Peter Block. I think I said at the beginning, Kim doesn't have a microphone because of technical reasons, but we'll work it out. So, Deepak, go ahead. Evolute and the partner trial. Now, this is surgery versus TAVR in low-risk patients. Hot stuff.
Hot stuff. These were probably the two most anticipated trials of ACC. And I must say, it's always tough because there was a great deal of expectations coming into the trial. That is, a lot of people were hoping, wishing, assuming that both trials were going to be positive, and in fact, they are, thankfully.
Yeah, but they're positive more than people really expected, wouldn't you say?
Well, it depends who you ask. I don't know. Certainly there were some people thinking it would just be similar. Yeah. I think a lot of people, maybe among the interventional crowd, were overly optimistic, but we're hoping for superiority. And there's certainly, I think, good signs of that from both trials, for sure, in the Partner 3 trial, statistically speaking. But even in the Evolute one, looks really good. And I think there's a consistency of benefit. We can maybe talk about are there really differences between the valves. But overall, I'd say class effect, TAVR beats SAVR across the board. Prohibitive risk,
it's bad to be in
low
the
risk,
hospital,
everybody.
Right? It's not good for you to be in a hospital. I mean, that's the short version.
Yep, minimally invasive wins.
Yeah. And I think there are differences in the two trials in terms of the way the valves are put together and what they do and don't do. But class action, they both win.
I think so, and I think patients win in this case, big time.
So let's move on from that. You know, one of the things everyone also said, I knew about this 3 years ago, what's the big deal? But it is a big deal. The data are really
It is a big deal. I mean, you've got to do the trial. It's one thing for interventionalists to assume that something works. It's another thing to prove it.
So
no,
Peter,
great trials.
I think this is a game-changing trial because those who were skeptical that these valves would be as good or better than really great surgery can now rest assured a patient at low risk can say, I want a non-surgical approach with good confidence. I mean, I do think it changes our practice.
Yeah, the question is, what about the 50-year-old with a bicuspid valve that's going to need an aortic valve replacement? Do you do a TAVR in those patients?
And we need the trials.
I'm not so sure. I'm not so sure we can say this trial answers that question.
I agree with that.
Yeah, I'm totally with you. I mean, we do need some longer-term follow-up.
But those trials now are underway, as you know, and then we'll know that in a few years.
Okay, so let's move on. Augustus, apixaban and clopidogrel versus warfarin for patients with atrial fibrillation. This is a game changer as well.
This is a practice-changing trial. This is a study looking at patients who have atrial fibrillation. They undergo a PCI, and they're randomized to two different types of treatments. One is the antithrombotic drug, apixaban or warfarin, and the other is whether you add aspirin on top of traditionally clopidogrel. And this study showed very clearly that the combination of apixaban and clopidogrel without aspirin is safer and as effective as any other combination. So this removes the notion of triple therapy. AFib, PCI, we can use two drugs, apixaban and clopidogrel, with great confidence.
Okay, Deepak, you put in stents. What's your take on this?
Look, I've been saying for a while, triple therapy, don't do it in terms of full-dose anticoagulation and dual antiplatelet therapy. You get a lot of bleeding for sure, especially in folks like over 80. You're guaranteed to get some bleeding. So now I think we have really definitive data that really it shouldn't be done.
Okay, we're 3 for 3 on this one. I too have for years said triple therapy is nothing but trouble.
Yep.
And now we don't have to worry about it anymore. It's gone. Let's move on. And we got drugs that really do the job just as well.
Yeah, great trial.
The POET trial. I like the POET trial. It's sort of a cool trial. It shows you that being in a hospital is a bad thing to be. These are patients.
Well, I sort of think of Dr. Eagle as a poet.
Oh, yeah. Well, Dr. Eagle is a poet, but
don't
maybe
you
not.
Love cardiology? We have these wonderful names that we pick. I just think we're so creative.
Yes, thank you. Okay, POET is a randomized trial of patients who have endocarditis, and some of them, once they're stabilized, are sent home as soon as they're stabilized, some as early as 10 days after IV therapy. And others are kept in hospital for the quote-unquote standard 2 weeks or sometimes even 3 weeks of therapy. What's the outcome between the two groups? It turns out being out of the hospital is really good for you. At 1 year, and that's a long time out from endocarditis, even mortality is lower, and the outcomes are across the board better in patients that went home on oral antibiotics. And you sort of scratch your head and say, what is going on? And I think the answer is being in hospital is just not a good thing. Kim?
Well, I think there's this condition called hospitalitis, where if you're in a hospital, you lose 10% of your body mass every day you're in bed, you're sleep deprived, you're in an unfamiliar place. If you're older, you may be disoriented. And so this trial proves to us that if we can safely get the medical therapy established and get the patient into the home with the right other supports, it's huge for patient outcome, and it's very reassuring. And at a time when our hospitals are stuffed with patients, this is a way that we can further reduce that problem too.
Yeah, and you didn't remember to say MRSA, because my dog just had an infection on his leg, and guess what? MRSA was grown out of it. Wow. And I went to the veterinarian and I said, why should he have MRSA in his leg? And she looked at me and said, where do you work?
Oh, so
Okay.
she really thought it was from you.
Oh, yeah.
Oh, wow.
She's quite confident it was from me.
I'm going to step back.
I was going to say, that's
Okay.
this is a dangerous
moving on.
interview.
The MOMENTUM trial, another very interesting trial and probably another game changer in terms of technology.
Yeah, so MOMENTUM is this study looking at heart assist devices, comparing traditional axial type of flow versus a magnetically levitated centrifugal flow, randomizing patients to the more traditional therapy or the newer magnetic therapy. And the event-free survival, which included things like stroke or whether you had to have the device removed, was better with the newer magnetic levitated device. And also other complications were dramatically reduced. So this is a real game changer in the field of LVAD and support before transplant, or LVAD as a destination.
Deepak, your thoughts on it?
Oh, I totally agree with what Kim said. This actually is a game changer. Maybe people that don't play in the LVAD space don't fully realize that yet. But I think the fact that reoperation's lower, stroke's lower, it's going to lower the barrier for putting in LVADs. So I think in terms of both, bridging and destination therapy, it's going to be a huge win for LVADs.
Yeah, well, you guys at the Brigham and you have a transplant program as well. We do at Emory. And we're always flummoxed by all these terrible complications of the HeartMate 2, right? They're hemostatic complications, stroke, thrombus inside of the device and so forth. The interesting thing about this trial is mortality was not changed between the two, but the incidence of complications was. And I said to the PI when I interviewed him, well, how does that happen? And he looked at me and said, we've gotten so good at taking care of these complications that the complications don't kill you. Right? You don't suffer from the complications, you suffer from the LVAD, because an LVAD is not a great thing to have, but at least now it's safer.
Right.
Yeah, big move forward, I think.
Okay, so those are the trials that we think are the important ones for day 2, and that's a wrap-up.